It is indeed my pleasure to introduce today the principal speaker for the event that we are going to have. He is both a dedicated medical educator and a respected physician. His name is Dr. Jonathan Goldner. Dr. Goldner has, for nearly 30 years, practiced internal medicine, geriatric medicine, and acute care medicine. He serves as the Chief Medical Executive for Medicine and Chronic Disease, as well as Director of Critical Care at the Pocono Medical Center. In addition to that, he's a real doctor. He has a practice, and he's practiced with the Pocono Internal Medicine Specialist in East Stroudsburg. Dr. Goldner is a role model for medical education. He holds the title of Assistant Professor both at TCMC as well as the Penn State Medical School. For TCMC, he's been a mentor and a preceptor. He's arranged the fourth-year electives that are held at Pocono, and he is one of our greatest champions for the growth in the Pocono area. I'm going to amend the speech and say he's one of the greatest champions for the growth in the entire area for us. He has been instrumental in recruiting the physicians who are with our 7th third-year students who are happy, healthy, and are having a great experience in the Pocono Medical Center. He works tirelessly to maintain TCMC's mission, and he's been recognized by the Fellow of Clinical Educators here at TCMC. We basically have, believe it or not, 900 plus volunteers who really volunteer. And recently we've established an academy. We've recognized 60 of these wonderful teachers, and they were inducted as Fellows and Masters in May of this past year. And of course, Dr. Goldner is one of the best and the brightest in the group. Dr. Goldner's passionate and cooperative approach to the practice of medicine guides his missionary work, and he has served in remote areas, including 7 years in Guatemala. He has done that under the auspices of Doctors of Osteopathy Care International. Through his work with Due Care, he has helped provide medical care for many who otherwise would not get it. So, it truly is an honor, it truly is a pleasure to introduce my friend and colleague, Dr. Jonathan Goldner.
For that very nice introduction. I appreciate that. Well, I have 30 years of things to tell you, so it might take a little bit of time. I apologize on that. But I'm truly humbled and honored to be asked to speak to you today on this momentous occasion. Today is a very important day. It's the day that you're going to be putting on a white coat as a member of the medical profession. You are being inducted into the most honorable and noble profession there is, that of helping others. I remember my first week in medical school, and we didn't have a white coat ceremony, but I remember being in orientation. And I was wondering if I had what it takes to be a physician. I didn't know if I was smart enough. I didn't know if I was going to pass out during my first surgery and make a complete fool of myself. I didn't know if I could take the blood and guts or the rigors of studying all the time. We know that you're going to do just fine, even if you do not. Many talk about this being a journey, but today is not the start of this passage for many of you. This started a long time ago, and finally has culminated with you being right in front of me today. Nor is this the end of the journey if you think that you did all this just to try to get here. But I would call it a turn of the road. But it's a really very important turn. My road started at the age of 16 when my dad, who was a general practitioner, got me my first job in a local hospital. I wanted to be an orderly, but they put me in the maintenance department. I think my parents thought I liked to fix things, and they thought I'd be an orthopedic surgeon. My career actually started with learning how to put the black wire together with the white wire, learning how to pull a septic pump out of the sewer tank, and for a real treat, I got to clean out the grease trap in the kitchen. What it really taught me was about camaraderie, respect, teaching, and something that's very effective in medicine today, and that's working as a team. I remember getting on the elevator with a physician who was in their white coat one day. Being a kid, I was only 16, I had my maintenance uniform on, I was very proud. I had my name on one side, my ID badge on the other, and I said a very prompt good morning to this physician there in the elevator. And I think I got something like a grunt in reply, actually. And I kind of mentioned that to my dad later that night, and he said, well, he's a surgeon. They're always like that. My father practiced, actually, family medicine for 50 years before a stroke occurred one day while I was seeing a patient. He told anyone that would listen that he loved practicing medicine and taking care of patients. His office was in our house, and he would go through a door to get there. So it made it easy for the commute home. He didn't have to really worry about rush hour or anything. He used to take me on office calls after his office hours, and I used to sit in the car in the dark in New York. He used to give me the key so I could put it in the ignition and listen to the radio. And I think nowadays, if we did that to one of our children, someone we'd be calling children and youth. But in those days, it was acceptable. Anyway, I remember as a child waking up in the morning, finding vegetables on our porch, which is the way some of the farmers used to pay for their health care. And many a night, after the phone would ring, I'd hear footsteps going past my bedroom door as my dad went to the hospital to care for someone. After 4 years of medical school and 1 year of an internship, he set out in practice doing things I would never have dreamt about. He delivered babies, set in cast of fractures, assisted at surgery, and took care of his own hospitalized patients. He used to have an x-ray machine that was built in the 1950s, and I'm pretty convinced that he gave us, his family, more radiation than the patient when he took an x-ray. I also believe the county sent in a hazmat team to remove the equipment when he retired. But obviously today, the science of medicine is really quite different. But the art of medicine, the use of compassion and empathy, is very much the same. For you, this new route starts with lots of late nights and seemingly endless hours of anatomy, biochemistry, genetics, pharmacology, and even the dreaded microbiology. But in this maze of information and examinations, you're going to learn how to heal. You'll even learn how to save lives. And when you can't heal or save a life, you will learn the important art of compassion, how to walk with someone through some of the most difficult, touching, and intimate moments a human being can experience. And it all starts here with putting on the white coat. Today, these white coats are really clean. Save the smell, how white it is. They will never be the same after today. For a physician, it's our socially acceptable backpack. It'll be filled with reflex hammers, stethoscopes, otoscopes, pen lights, procedure logs. As time goes on, the number of items decrease, and I would say it is generally true that the number of items in the coat is inversely proportional to the seniority of the person wearing the coat. Don't forget to look at it on occasion. You'll be surprised how filthy it gets with just normal daily activities, and it doesn't always smell like a bed of roses. Putting on this white coat when you see your first patient most likely will not instill unwavering confidence, experience, superior medical knowledge, or a steady hand. What it most likely will do is instill a lot of anxiety, some nausea, and a feeling, what did I get myself into now? Kind of thinking. But the good news is, this is normal, and I would certainly expect it. You're being taught and trained at a medical school that in its short life has already an excellent reputation for academics and clinical training. Your administration and faculty here at TCMC truly care about you, something I've been immensely impressed with. They will do everything possible to ensure that the necessary training and experience is there to be a great physician. Some days late at night, while you're studying for morning exams, you may doubt that. That is also normal. But you will realize when you graduate what they have given you, and appreciate where you've gone together. I really thought long and hard about what I wanted to tell you, and this really comes from my heart. But I wanted to say something that would be useful to you, some things that have occurred to me over 30 years of practice, and something that you would remember 8 years from now when most of you will be going into practice yourself. The first and most important is that you will have unbelievably uplifting experiences being a physician. There's no higher calling or more positive feelings than helping to heal the sick and injured. You will develop relationships with your patients that are unparalleled in other professions, and you will be highly regarded by others for doing so. Being a physician comes with a lot of great days that are very happy and positive. Being part of a team that saves a life is a great feeling. However, some days, despite your best efforts, your patient may succumb to an illness or injury. You will have self-doubts about your abilities and even possibly a lot of guilt. Those days may be very dark and disheartening, but you will need to expect those and also realize that they will get bright again. To get through those dark days, embrace your family and friends. Do not shut them out. Before you can take care of others, you will need to take care of yourself. Depend on your fellow students, help each other, and watch over each other. Do not wait for someone to ask for help. Look for signs they are in trouble, and ask if they are okay. Be persistent. Many of us refuse help initially. The second tenet I have for you is to act professional. Play well in the sandbox together, as medicine these days is a team sport. Listen to your team and, of course, your patient, because they're part of the team as well. Don't be offended when they question what you order. There's been many a nurse, a pharmacist, a respiratory therapist, and even a surgeon or two that has stopped me from making a mistake. Do not let your ego get in the way of helping your patient. The third tenet, from this point on in your medical career, you will always be learning. I learn every day, and every patient will teach you something. You will see thousands of patients in your career, but a few will be transformative, which you will always remember and will change things for you. I want to relate to you a story of one of mine. One Saturday night, about 20 years ago, I received a phone call from a hospice nurse that she had an elderly gentleman that had terminal brain cancer and was having persistent seizures all day long at home. She felt that he needed to be admitted to the hospital for control of the seizures. It was late, I was about to go home, and I was extremely tired. Although I was not the type really to yell on the phone, and I'm pretty sure I didn't do it that day, I'm quite sure that I expressed my displeasure to having been called at that hour with a problem that had been occurring all day. I was frustrated as I was close to going home. After waiting for this patient for over an hour and then admitting him to the hospital, I was witness, as his family had been all day, to these unrelenting seizures. It was absolutely horrible. The patient was clearly dying, in distress, and it was all witnessed by his family hovering at the bedside. With one dose of intravenous medicine, it really didn't take me a lot of thinking to make the diagnosis and come up with treatment, the seizures actually stopped, and he appeared very comfortable. The family could not express enough thanks and gratitude, people who I had just met. I realized in that 1 hour, I had done more for that one patient and his family than any other patient that day, that week, and probably that month. He died peacefully the next day with his family at his bedside. I could not save him, but I relieved his suffering and that of his family. I remind myself that day that this was what being a physician was really all about. The fourth tenet is that you will make mistakes. As physicians, this is very hard to accept, and it's even harder to admit to others that you've made a mistake. But I will tell you that I've made mistakes. Every physician in this room has made mistakes, and we will continue to make mistakes. But our job is, as a profession, we need to accept this, and we need to learn from our mistakes. Try to make the processes and systems that we work on safer, and we never make the same mistake twice. It is also acceptable to apologize to a patient or family when we've made a mistake. The fifth tenet, you will always find the greatest pleasure in giving things away. Many of you will be asked by Aunt Mabel what you think about the mole on her arm, and as of this week, congratulations, you now become the family expert on healthcare reform. Volunteer your time to take care of the indigent. Your payment will be the satisfaction that you're making a difference in someone's life. Be a leader in your community and volunteer your time to work with numerous great organizations such as the Red Cross, American Heart Association, or the American Cancer Society, to name just a few. Give your time to doing a medical mission in a foreign country or work on a disaster medical assistance team in the United States. You'll be reminded how precious a life is, how much fun it is to help people, and be shown gratitude that is just unconditional. The sixth tenet is be a mentor and a teacher. Many will look up to you for guidance, whether it be your patients, family, community members, colleagues, or medical students in the future. Physicians will give their time and efforts to mentor and teach you, and thus your obligation in the future is to give back that time to other students of all disciplines. Today you are putting on your white coat, and I hope that you never have to take it off to the day you want to retire. We are also very proud of you, and we are also very glad that you're here. I'm especially humbled to be before you today, but I want to leave you with one final important thought. Don't forget to say hello to the maintenance man. He's part of the team. Thank you very much.